Good afternoon, ladies and gentlemen. Today we are going to present a spectrum of neuromuscular disorder and peripheral neuropathy. Medicine is an ever-changing science as new research and clinical experience broaden our knowledge, changing in treatment and drug therapy are required. While the enormous advances in imaging, genetics, molecular biology, and pharmacology have improved our capacity to diagnose and treat disorder of the nervous system, they have not reduced the necessity to understand basic principles of anatomy and physiology, to obtain the correct history, perform a capable neurological examination, and to cohere them based on a body of clinical knowledge and experience. Neurology is a broad field of clinical study of the nervous system. Under the scope of spectrum of neuromuscular disorder, we have different side of the following subtopics are included. The neuronal cell which affect the disease which affect the neuronal cell bodies is motor neuron disease, and which affect the peripheral nerves, that is peripheral neuropathy, and disease at the neuromuscular junction is myasthenia gravis, and muscle disease affecting muscle are myopathies. The first topic will be on motor neuron disease. Motor neuron disease is a disorder that affects the motor nerve controlling voluntary muscle activity. It is a progressive and eventually fatal condition affecting motor neuron and causing the motor function to stop. It doesn't affect the sensory neurons. Understanding its type, causes, symptoms, and treatment options are crucial for management. There are several types affecting different motor neurons. The main types are one is amyotrophic lateral sclerosis. In 60 to 85% of the cases, a combination of upper motor neuron and lower motor neuron dysfunction. The second type is progressive lateral sclerosis, upper motor neuron dysfunction with substantial muscle spasticity. The third type is progressive muscular atrophy, which involves lower motor neuron dysfunction with flaccid weakness and muscle atrophy. The fourth one is progressive bulbar palsy. It is the second most common, and exact cause is unknown. Genetic mutation, the exact cause of motor neuron disease is unknown by either genetic mutation or exposure to environmental toxins such as heavy metal and pesticides. ALS was previously considered as rare, but incidence is rapidly increased to 30% by 2040. ALS is multi-system disease that commonly causes cognitive and behavioral changes, especially to 1/4 of patients meet the criteria for dementia. Diagnostic delay may reduce access to treatment and support that would improve survival and quality of life.
The incident peak is in the age of 50 to 70 years.
Small nerve fiber တွေကတော့ pain တွေနဲ့ပို့ပြီးတော့သက်ဆိုင်တာကိုတွေ့ရပါတယ်
ဒါကြောင့်ကျမတို့ဒီမှာပေါ့နော် myopathy case တွေဆို experience နဲ့တယ် exposure နဲ့တယ်ဒါကြောင့် myopathy case တွေ့ပြီဆိုလို့ရှိရင် work up လုပ်ဖို့ဆိုရင်နည်းနည်းခက်ခဲတယ်ထင်ရတယ်ပေါ့စာရဖတ်မယ်ဆိုရင်လေကျမတို့တော့ခက်ခဲတယ်ထင်ရတယ်ကိုပစ္စည်းကိုရအောင်ပြန်တိုက်တဲ့ ပရိပစ္စည်းတွေထွက်လာတဲ့ mechanism ပေါ့နော်အလုံးစုံမသိသေးပေမဲ့သူတို့ဒီဒါတွေကြောင့်အကုန်ပူပေါင်းပြီးတော့အဲ့လိုဖြစ်လာတယ်ဆိုပြီးယူဆတယ်အဲ့တော့ဒီအနီကွက်ကလေးတွေကတော့နောက်ပိုင်း treatment မှာပါမယ်ဘယ်နေရာတွေမှာသွားပြီးတော့ဆေးတွေကသွားတိုက်တယ်ဆိုတာကိုပြောမယ့်ဟာဖြစ်ပါတယ်
Zifam, caring for well-being.